Today is another landmark day for our nation. It has been just 10 months since we've been on the defense against this virus. We've been social distancing, we've been washing our hands, and we have been wearing masks. It is time to turn the table. And we started doing that last week. We went on the offense. Last week, we kicked off the initial distribution of the Pfizer vaccine following EUA. Through snowstorms, holiday rush, and with everything else going on in the country, we delivered the first 2.9 million doses across the country to every state. And we saw vaccines going into arms. What a remarkable feat. And we should all be proud of what has happened, but I want to particularly praise the great men and women of Pfizer, McKesson, UPS, and FedEx for a truly outstanding job. Thank you. Last night, the FDA granted emergency use authorization to Moderna. In America, we are ready to distribute that vaccine. Just as we did last week with Pfizer, we are prepared. So what does the playbook look like? Distribution of Moderna vaccine has already begun. Moderna has moved vaccine from their fill-finish manufacturing sites to McKesson, who will serve as the central distributor. At McKesson distribution centers, boxes are being packed and loaded today. Trucks will begin rolling out tomorrow from FedEx and UPS, delivering vaccines and kits to the American people across the United States. We have begun shipping ancillary kits, including needles, syringes, other supplies that are required to give the shots. For all future shipments of vaccine, we will marry these kits up together and distribute them as we get into our regular cadence. McKesson will leverage the professionals of UPS and FedEx, and we have absolute confidence that these three great companies will deliver vaccines to the American people in a safe and timely manner. Moderna vaccine can be shipped and stored at standard freezer temperatures and is packed in containers of 100 doses each. This allows jurisdictions the flexibility to support hard-to-reach, small, and more rural areas. But this is a state's decision. States have worked hard on their plans. They understand the priority groups, and they have allocated vaccines to locations and sites where they will best meet their plans. We are in full support of them. This week, in total, between Pfizer and Moderna, we have allocated 7.9 million doses of vaccine, and we are ready for that distribution. First dose distribution. We will ship simultaneously to all 64 jurisdictions and 5 federal entities. Jurisdictions have already ordered the vaccine, and we know it is going to 3,700 plus locations, with more requests coming in every day based on allocations. Shipments will begin arriving on Monday and continue through the week. Moving forward, this will become our regular cadence of providing allocations, receiving orders, and shipping to the American people. We have already learned a lot of lessons from last week in the initial rollout, and we will continue to apply those lessons as we move forward. I know we'll learn more this week, but I'm also confident that we will have the agility to correct ourselves and get things right so that the next time it will go flawlessly. Now, this week, many have heard concerns about allegations of vaccine doses being cut. I want to assure everybody, and I want to take personal responsibility for the miscommunication. I know that's not done much these days, but I am responsible, and I take responsibility for the miscommunication. Here is the bottom line. I want to make sure that we are 100% committed to fair and equitable distribution to everybody in the United States of America. And I give you my personal word That is what I'm driving to. Jurisdictions have asked me for planning numbers, and rightly so. We want to be open and transparent with them at all times. I have to work on the estimates that we know, and we provide them forecasts accordingly. But vaccine manufacturing is a very arduous, technical capability, and we work hard in collaboration with them to know the process, to understand where we're at with the process, and then to make our best forecasts accordingly. But at the end of the day, what should really give you great confidence, everybody in America should have great confidence. The FDA is the gold standard, not just in America, but around the world. And they require the highest levels of review at the highest standards before doses of vaccine are released to the American people. I personally appreciate that. At the end of the day, the number of doses available to us to allocate ended up being lower. And so as we gave forecasts to the jurisdictions and governors and states worked their priorities against those forecasts, when we had to decide what was going to eventually be shipped out, I had to lower the allocations to meet the releasable doses that were presented to me. We look at this every day and every week, all right? And only when I am confident that the vaccine is releasable and that I have first and second doses can I move it forward. So to the governors, to the governors' staffs, please accept my personal apology if this was disruptive in your decision-making and in your conversations with the people of your great state. I will work hard to correct this, and we have done several things to do this right. Because this is a Herculean effort, and we are not perfect, the key is to be transparent and to openly communicate at all levels, step by step. To that end, we are in constant dialogue with both industry partners to ensure doses are available. But here's the key. The doses must be releasable in accordance with the FDA. We have developed a cadence that we are briefing to public health officials. We started last night. We're briefing it again today, and I will personally brief governors on Monday. That will provide more predictability to the outcome we're trying to achieve. We want the American people to have confidence that the cadence we have established will ensure safe and effective vaccines are delivered to them accordingly. Every week, we plan on allocating vaccines based on releasable doses, and every week, we will work with the states to ensure the vaccines are distributed to the locations that they direct us to at the quantities that they direct. At the end of the day, this is all about enabling the governors and the states to ensure that their people receive the vaccine in a fair and equitable process, and that when they receive it, they can have confidence that the vaccine is safe and ready to be administered in their arms. We want arms, shots in arms. That is our goal, and we work tirelessly every day to make that happen. It is a whole of America approach that is executing this, and I want to give you my personal word that we are working this to the extreme, but with caution to ensure safety of every vaccine that is distributed. I personally updated Secretary Azar on where we think we are with numbers. We remain on track to allocate around 20 million doses of vaccine to all jurisdictions by the end of December, with distribution of those doses pushing into the first week of January. I ask us all to stay focused on what really matters. We are pushing out millions of doses of vaccine right now, and each week those numbers will continue to grow. Every member of Operation Warp Speed wants vaccines in arms, and we are doing everything possible to that end state. But we will not cut corners. We will hold ourselves accountable to the standard and approval of the FDA, and then we will assure timely and effective distribution to where the governors and the states want the vaccine. While this second vaccine from Moderna, added onto Pfizer, now allows us as a whole of America to be on the offense, we are a long way from being finished. Each shipment of vaccine is another few yards gained, but any good player or coach knows that you still need defense along with offense to win the game. I join our health professionals in urging Americans to stay diligent in their defense. Wear a mask, wash your hands, and stay socially distanced. While we move the ball down the field with vaccines, we will score. We will get to the end zone. It just will take some time to do so, and we need your help to get to that end. So thank you for your time today. Thank you to all the men and women of Pfizer, Moderna, McKesson, FedEx, UPS, and I will tell you, also going down into CVS and Walgreens as we've started doing immunization through their efforts down at the long-term healthcare facilities. I just want to say thank you to those men and women who are working day and night to make this happen. I am incredibly proud to be an American and stand here in front of you today. I will continue to provide updates along with Secretary Azar and Dr. Salawi throughout the week, but until then, I can take a few questions before I wrap up.
All right, operator, we will now open the floor up for questions. A friendly reminder that when asking a question, please state your name and publication, and please keep your questions as short as possible so that we can get to as many questions as we can.
Thank you. As a reminder, it is *1 if you'd like to ask a question from the phone. And the first question comes from Elizabeth Reese from USA Today. Your line is open.
Hey, thanks so much for taking my call. I wanted to ask about this, the reduction. Why did it take from Wednesday until Friday night for clarity to come as to why the numbers were based on vaccine that hadn't gone through the full process yet?
So it didn't take that long. We realized, quite frankly, the next day, because governors and their staffs were alert and calling us. And so what we had to do was do some forensics on what the disconnection was. So in simple terms, we allocated vaccines on Tuesday night. That was a change. We were originally allocating vaccines on Friday, but governors had asked in lessons learned that it would help benefit them in their planning if we moved it left. So absolutely. So we moved it left. We put allocations in place on Tuesday night. What had been out previously to Tuesday night allocations was a forecasted worksheet that laid out what we thought might be possible in eventual distribution. That sheet was out because I want people to get ahead of the problem and work through it. But at the end of the day, when I snapped the chalk line on Tuesday and approved the allocations based on releasable dosages, there was a difference between the worksheet and what I approved to go into Tiberius. Calls came in immediately the second day as we were working through, the process of the difference between forecast and actual allocation. And we worked with governors, their staffs. I briefed made several phone calls myself to talk to governors, had a great phone call with the governor of Washington, Governor Inslee. I really appreciated his time that he allowed me to walk him through the process. Very grateful. I was able to also talk to Senator Reid up on the Hill and walk him through the process. There was many other phone calls that were made by the staff out to many teams to help facilitate this conversation. At the end of the day, again, I accept responsibility for the miscommunication. We're learning. Our strategy was to push the first major pushes from Pfizer and Moderna, stocks that we had stacked up and were ready to go. And an initial push after EUA, relatively easy. We had very good plans that had been worked through from the states all the way through OWS, CDC, down to our industry partners. The key was transitioning into a regular cadence of available vaccine dosage so that we can just keep moving. We don't want to pause and then collect vaccines and then distribute a week or 2 weeks later. We just want a continuous flow of vaccines out to the American people every day, extending availability to more. In order to do that, we have to forecast, and then we have to eventually figure out what is available. Again, I take responsibility. I'm learning that as we go. It looked very good on paper. Paper plans are very good. Execution is where we learn, and we adapt it accordingly.
Operator, next question.
The next question comes from John Tazzi from Bloomberg. Your line is open.
Hi, thanks so much for taking my question. Can you tell us a little bit more about the sort of difference between when vaccines are manufactured and when they're released, and how many of the Pfizer doses coming out of production don't pass the quality assurance or other checks that actually make them releasable?
So I don't know the exact details on that. We'll garner that for you and get you a better answer in timing and collaboration on that. I tell you, it's a very rigorous process, and the FDA does a fantastic job doing that. There is a delay between what is available and what is releasable, because we're talking about hundreds of thousands and millions of doses that we want to make sure are right. To this date, to the best of my knowledge, there has been zero problem with the Pfizer vaccines, from going from manufactured to releasable. It is just about the process that you have to go through to get to releasable.
All right, operator, next question.
Thank you. The next question comes from Rachel Rubine. Your line is open.
Hi, this is Rachel Rubine with Politico. Thanks for taking my question. This is sort of in the similar vein, but when the doses were not releasable, it sounds like, one, were you originally counting all the doses and not the ones that were releasable? And two, was it that Pfizer hadn't yet sent the doses to FDA to kind of get FDA's stamp of approval, or was it that FDA was still working on giving the stamp of approval to make the doses releasable?
Okay, so there is a standardized cadence of approval for vaccines when they go from the completion of fill finish to releasable. Where I failed, nobody else failed, is to have a clear understanding of that cadence. So when I applied it into our forecast methodology and our planning with the states, I realized that there was a delta to the numbers that I personally thought were available and ready for distribution and what was releasable. I can't say it any better than that. It was my fault. I gave guidance. I am the one that approved the forecast sheets. I am the one that approved the allocations, right? There is no problem with the process. There is no problem with the Pfizer vaccine. There is no problem with the Moderna vaccine, right? It was a planning error, and I am responsible. And I don't really know how to say it any clearer than that. We're learning from it. We're trying to get better, because at the end of the day, it is about facilitating the most available vaccine doses out that are releasable out to the American people.
Operator, next question.
Thank you. The next question is from Karen Stacy. Your line is open.
Hi, this is Karen Stacy from the Financial Times. Could you just explain a little bit about what your error was, particularly there? Is it that you didn't realize that this extra approval process had to happen to make these doses releasable, or you just thought it would take less time to do?
A combination of everything, right? No, this has never been done, right, in our history. Normal vaccines, right? Let's just take influenza as an example, right? The country gives their orders to industry. Industry spends the next 6 months developing and producing and proving that vaccine for distribution, and then it's distributed in a timely manner. What we have done is to take the process that is well regulated and standards highly enforced, and we've converted it into execution for a COVID-19 vaccine, which is, as the vaccine is developed, we are pushing it out to the American people. A simple course of action, but a totally, in my opinion, inappropriate and unethical decision would have been to stockpile COVID-19 vaccine, walk through all the process that is normal, right? Wait for it to all be approved and releasable, and then distribute it 3-4 months from now. So the mistake I made is not understanding with exactness, again, my responsibility, on all the steps that have to occur to make sure the vaccine is releasable. At the end of the day, here's what I think about. Will my mother have a safe and effective vaccine, right? Will the American people have a safe and effective vaccine? I failed. I am adjusting. I am fixing, and we will move forward from there. Over.
Operator, next question.
The next question comes from Meg Terrell from CNBC. Your line is open.
Hi. I'm wondering if Operation Warp Speed has projections, as more vaccine supply becomes available over the weeks. Is there, a limit at any point that you've been told, just from all the communications with the states, as to how many vaccinations can be performed in this country per week? At any point, you kind of have to say, well, we've got more supply than we can actually ship because we just can't perform more vaccinations. What is that limit per week?
Yeah, so we're not there yet, and my sense, based on on what we project we're going to receive over the next few months, we're not going to reach that limit. I think the key is access to the vaccine to the most places throughout America. We are calling them providers, and we have over 50,000 providers that are enrolled across the country. Visualize them from everywhere, from hospitals, doctors' offices, pharmacies, pharmacy chains, etc. And we think that that quantity and the distribution of the vaccine will provide everybody in America the access to the vaccine when the supply is available. So I don't see us reaching a point where we'll be constrained, where supply will overrun capability and capacity to administer, but we'll manage and we'll work that as we go forward.
Operator, next question.
Next question is from Jill Colden from the AP. Your line is open.
Thank you so much for doing this call. I just don't want to hammer this point, but I was just hoping that you can explain in very simple layman's terms that anyone can understand exactly what needs to happen to make doses releasable. And also, I think you made a reference there to second dose availability. Did that play any role in this process?
So I'll answer the latter, and yes, second dose availability is key for us. The strategy is that we release first doses when we have second doses on hand, and we have confidence that the releasable doses will meet that requirement. I am not going to spend any more time talking about the details in between, fill finish and releasable. Thank you.
Operator, next question.
The next question is from Eric Coolish. Please state your media outlet. Your line is open.
Yes, thank you. Eric Coolish, FreightWaves. Wondering if you've had any more temperature excursions like the 4 trays that you talked about earlier in the week, and if you've analyzed and found out what happened with those, and why is going to 80 or 90 degrees even colder a problem?
So no, we've had no more than what I've talked to you about, and we've run the checks. Pfizer has run the checks and collaborated with the FDA, and going down below -80 to these excursions were -92 have no effect on the vaccine. But they wanted to make sure, and they wanted to make sure not only the vaccine remained safe, but also the vial containing the vaccine, the seal, etc., was still appropriate. That's been approved, and there's no issues with that. The vaccine, as they're theorizing, and we're not there yet because we don't have enough situations to really truly validate. But as you know, the vaccine travels right in the air, et cetera, the dry ice shifts, et cetera, the temperature fluctuates into a colder temperature. Poor choice of words, apologize. And hence the minus 92. The key of this is the diligence and the professionalism and the immediacy which Pfizer reacted in combination with FedEx and UPS. Remarkable ability to see themselves, right, take control, quarantine, return, and replace the vaccine was just spectacular. And I applaud everybody involved in that.
Operator, we have time for one last question.
The last question comes from Sarah Murray from CNN. Your line is open.
Hi, thank you very much for doing the call. So given the way the cadence has gone so far with the Pfizer vaccine, I'm just curious what gives you guys the confidence that you'll be able to reach the dose goal you set for yourself for the end of the year?
So I think, you know, we've done a lot of work, right? A lot of planning on this, a lot of collaboration from the CDC experts through commercial industry, both the manufacturers and those that are distributing as well as working with the states on final administration. As I said earlier, it is a plan. It is a plan that we've rehearsed many times. But at the end of the day, it's when things go into action that we figure out if there's something not right. Based on everything I know right now, I feel confident that we'll have the allocations of $20 million by the end of the month, and that we will be literally finishing distribution of that $20 million inside the first week of January. Now.
All right, operator, that's all the time we have today. Please send any follow-up questions to our press office at media@hhs.gov.